Hi, Dr. Berardi here, coming to you from North Scottsdale, and every once in a while someone will ask, why did I become a plastic surgeon, or what led me down this path? And it actually started in college. So I've known I wanted to be a plastic surgeon since I was a sophomore in college, and this was directed from, or at least suggested from one of my roommates at the time, who said, you are really good at your biological sciences and you pick up the anatomy very good, you should look into medicine. And so I entertained that idea. Now, prior to me heading down the pre-med path, I believe my freshman year in college, I was actually a forestry major, believe it or not, which I love the outdoors. I like the idea of animals, trees, you name it. I'm a very avid outdoorsman. So initially I was a forestry major, but thankfully, again, my roommate at the time suggested maybe you should look into the pre-med program. And I went and spoke to this crotchety old chemistry professor who was the pre-med advisor, and he was about as pessimistic and I guess grumpy as could be, as since, well, here are all the requirements and extremely difficult, and you have to take all these classes and it's challenging. And I said, sure, okay. And I guess what headed me down the path, he said, you have to find a preceptor in the community, as in a physician in the community, to shadow, to say, this is what medicine's about. Because up until that age, you go to the doctor for personal reasons and get checkups and get shots, and that's your experience of a doctor's office. So one of my fellow students suggested a plastic surgeon in the area that readily took on students. So I went to school at NAU up in Flagstaff, and I called Dr. Jack Quigley, who is still a practicing plastic surgeon in Flagstaff, Arizona. He said, come on in. So as a sophomore in college with no formal medical training, I was following him around in his office, and he's actually scrubbing into surgery, which was just an unbelievably amazing experience for someone in college that probably a few weeks earlier wasn't even thinking, had a clue about medicine. So we did mainly our reconstructive cases when I was in his practice, and one of the very first cases I did was what's called a free flap, where we take a muscle and its blood supply and we transfer that to another part of the body and sew the blood vessels to blood vessels in that other part of the body to create a vascularized or a tissue that's filled with blood in order to reconstruct. In this particular case, it was the six-pack muscle from the abdomen, and we transferred it to the bottom portion of a woman's leg who had been hit by a car while pushing her motorcycle down the road. So it destroyed a lot of the tissue, but needing a free flap to heal it. So we went on and did surgery after surgery, and there was another one where a gentleman, when he was a child, was diagnosed with cancer and had this patch on his neck, which was a chronic ulcer from radiation. And with that particular case, we took a muscle from the chest and moved it up on his neck and took out the bad skin and covered it with good skin. So right there, I was sold. I wanted to be a plastic surgeon. The absolute amazing ability for the body to heal. For us, you wouldn't think of it, but we kind of have spare parts where we can take from one place and put it to another. That got me down that path. So that's the pre-med portion, and then you do all this to get into med school. Well, in med school, it's a similar situation where, okay, I wanted to be a doctor, but what type? In my head, I know I wanted to be a plastic surgeon. However, in medical school, at least during the second 2 years, you're going to rotate through all the specialties in medicine that you can imagine. You have family practice, you have internal medicine, you have general surgery, you have neurology, you have obstetrics and gynecology. So you go through all this whole process hoping that you're going to figure out something that you're passionate about. Well, I continued down the path, kept an open mind, saying, well, maybe something else jumps out at me. And still, plastic surgery was the one. And we had the same situation in Tucson. I went to U of A for med school, where you wanted to find a preceptor in the community. And there I spent time with Dr. Gwen Maxwell, who on the other end of the spectrum, we did all cosmetic surgery or aesthetic surgery. And she was a fantastic role model. She had me scrubbing into surgeries, had me seeing patients. part of our requirement for medical school was we had to conduct full history and physicals on patients. And these would take an hour, hour and a half. And you're talking every little detail about their life, their health history, and doing a head-to-toe physical exam. And this woman, Dr. Maxwell, was so generous. She had her aesthetic patients who had no reason to come in, but she had her aesthetic patients come in and sit with me, a medical student, for an hour on end as I did a physical exam so I can write them up and turn them in for one of my classes. So started in college, progressed through med school. Obviously, that passion for plastic surgery continued, and I started doing plastic surgery rotations, and then I knew it was the career for me. So once you decide on that, you put in for a residency program. Residency programs are highly competitive. When it comes to plastic surgery, there was two routes you can go. You can either go straight into a plastic surgery program where you did your residency in general surgery and your residency in plastic surgery at the same program, or you can go through general surgery and then go from general surgery into a plastic surgery fellowship. Fortunately, I was able to do the combined program or integrated program, which means I started in one place and finished in the same place for my plastic surgery training. So there you have it, and I owe a debt of gratitude to Dr. Jack Quigley as well as Gwen Maxwell for being great mentors, showing me that plastic surgery is just an amazing field, and it's fulfilling, it's rewarding, and to this day I still love my job.